Colleagues and friends, welcome to the first Sudanese Optometry Society conference on Zoom platform. It is my great pleasure to stand before you as you gather with shared purpose to learn, to share, and to advance their vital field of optometry. Whether you are here as a practitioner or dedicated researcher or student boarding on your career, your presence strengthens our community. We have a remarkable program ahead, filled with insight from leading voices in our field, covering clinical innovation to public health perspective. Our sessions are first, mastering optometry practice for myopia management, contact lens and anterior eye, and vision of progress, technology awareness and specialized care, with 15 speakers from different countries. On behalf of the organizing committee, thank you for being here. Let us make today insightful, collaborative, and memorable. At the beginning of this conference, allow me to introduce Dr. Mustafa Abdu, President of Board of Director for the Sudanese Optometry Society, to open the conference and welcome the attendees and speakers.
Assalamu alaikum warahmatullahi wabarakatuh. Thank you, Dr. Zulfaqar. Good evening, distinguished guests, respected colleagues, honored speakers, and attendees. On behalf of the Sudanese Optometry Society, I'm deeply honored and pleased to extend a warm welcome to all attendees at this significant event, the inaugural Sudanese Optometry Society Conference. We are absolutely thrilled to host this global community of eye care professionals. While we miss seeing you in person, the virtual platform allows us to break down the geographical barriers and connect with more innovators than ever before. So thank you for tuning in and making this event possible. We welcome an outstanding group of speakers, both local and international, whose expertise will enhance our understanding and inspire our practice. And a special welcome to our esteemed keynote speakers, Dr. Rajeev and Dr. Carla Lanza, who will be challenging us shortly with their presentations. We extend our gratitude to all for contributing to this intellectual journey. We also want to specifically welcome our distinguished guests joining us from the World Council of Optometry, Eastern Mediterranean Council of Optometry, Saudi Society of Optometry, Vision Care Association in Lebanon, Oman Optometry Club, Yemeni Society of Optometry, Somali Optometry Association, Pakistan Optometric Society, the IACL Ambassador for the Middle East, the geographical representative in the WCO, OptoGlobe organization, and also we welcome Professor Kamal Hashim Binawi, the former Director of Prevention of Blindness in Sudan. I would like to express my gratitude to the brilliant team on the organizing committee, our moderators, and everyone who has tirelessly worked behind the scenes to bring this vision of fruition. So your dedication has made this gathering a reality. I also cannot forget to thank the WebServe for Smart Solution Company, the media sponsor for our conference, and I especially thank Dr. Ahmed Magdi Shafiq, the team supervisor, for all the support. To all our attendees, your presence here is a testament to your passion and commitment to growth. I encourage you to engage actively, ask questions, share your thoughts and experiences, and build connection with that will strengthen our professional community. Let this conference be a platform for learning, dialogue, and collaboration. Maybe the discussion we begin here, continuing to resonate, driving progress and innovation in Sudanese optometry for years to come. So welcome once again to the first SOS conference. I hope you have an enlightening, productive, and memorable experience. Thank you, thank you, thank you, and let us begin.
Thank you, Dr. Mustafa, for this inauguration. Let us start. It is now great pleasure to introduce our keynote speaker to this introductory conference, Dr. Rajeev Barasad, President-elect World Council of Optometry, President Asia Pacific Council of Optometry, Secretary General Indian Optometry Association, founding President International Academy of Myopia Control, India, chapter founding board member, Global Optometry Public Health Alliance, and founder and director of Visual Eyes India. Dr. Barasad, an MSU, MSU Optometry from the College of Optometrists UK, and is a member of the College of Cyanotronic USA and the Neuro-Optometric Rehabilitation Association. His leadership roles include organizing different international conferences. Dr. Barasat has developed low vision rehabilitation units across India and advanced myopia management. He mentors postgraduate scholars at Chandigarh University while contributing to the global optometry field with his expertise. He will speak to us about future of optometry in developing nations. Welcome, Dr. Rajeev.
Thank you so much, Dr. Mustafa, Dr. Zulfikar, my brother Amir, and all the friends from, Sudanese Optometry Society, from UAE, from different countries who are present here. Am I audible clearly?
Yes, doctor.
Oh, perfect. So I'm really glad to be here in front of you all at this, evening and, share the views. And, this is great that the website is launched finally. And, me being an Indian origin, I can easily understand and I feel that, what developing nations are going through. And we always look at to developed nations where the optometry is. And we always strive to go to a level that when and how we are going to get into that, right? And I think that's the future, and the inclusion of technology, policy, and integration is the key. So I think there was a wonderful introduction already, so I'll just quickly move forward. So, in developing nations, couple of challenges which I personally see that which pops up, that even WHO has identified it: affordability, availability, and accessibility. And imagine, what if the key to blindness wasn't a very expensive device of, say, 630,000 or, whatever amount, 4,000, 400,000 or something. But even something as lighter as than a stethoscope and affordable enough to be used anywhere. And that is where, the role of optometrist comes. And we always look at on different aspects, but at times we miss out that there is a big chunk. If you see the global blindness scenario, the biggest chunk is a URE beside cataract, right? Cataract comes second, now it's moving gradually, and then diabetic retinopathy is increasing, and And the availability of optometrist is really less. The current availability, some of the data shares that, in developed country, this is one optometrist for every 10,000. Whereas in low, medium, like, low, medium, middle income countries, it is one optometrist for every million people. So, that's how the opportunity is. Say any country has, say, 50, 100,000 people. So the opportunity goes like for 100,000 eyes, what we are looking at. It is not everybody has two eyes, right? So that's the opportunity to serve and to cater. Now, what are the major barriers in terms of, access of eye care in developing nations? Definitely equipment, sustainability, accessibility, affordability, which even WHO Specs 2030 program has come forward with, and then workforce and infrastructure. That is where we lack most of the things. We often look at developed nations in terms of equipments, and we don't have that much. And probably because of per capita income of each of our countries, the challenge is we cannot afford to buy the equipment because most of the equipments in developed nations, they are either from Germany, US, Europe, and various other places. And, the costs are so very high, it becomes a challenge. So low cost equipment is a tough task. And once you buy it and there is some challenges, then, getting it maintenance and repaired, and then you end up paying huge amount to the maintenance cost, right? Second problem is accessibility. And why this is because, people in remote area, in rural area, they cannot travel to get a properly, say even a pair of glasses. I mean, they have to travel long. So, and we don't have much of sustainable program. Quite often we conduct different camps and many things, but those things are like, off and on. There is no sustained program, it is there. I mean, which we see that, okay, I mean, even if people, the funding agencies are not able to fund it, how we are going to handle it? And definitely lack of legislation is another big challenge, which often creates a problem because, we all know that the future is going towards collaborative approach between all the three O's, which is ophthalmology, optometrists, and, opticianry. But it is like kind of, most places it goes like love and hate relationship. And that is where the future lies, that the future is now going towards collaborative approach. It is not about encroaching this area or that area. It is all about how best we can do it. For example, in like, if I say vision therapy, if somebody has, say, 45-degree exo, so either the patient can get it operated and come for the therapies, or you do vision therapy, reduce the, deviation maybe by up till 15 degrees, and then get it operated. So that's a collaborative approach where, optometrists and ophthalmologists can work together along with opticianry, how much prisms to be given and so on. In many countries, I mean, there's a lack of legislation, which I mentioned that, optometrists is not allowed to do certain things. Even putting, when you talk about optometrists, it is refraction. And in many countries, you cannot put actually drops, right? Dilating drops for atropine or whatever. So it becomes a problem for many of us. So the gaps in regulation and education, it is definitely inconsistent professional landscape, which really impacts optometry and limits it. The regulation, less than 44% of countries formally regulate optometry as an eye care profession, and that creates a vacuum in the standard and patient safety. Another piece is education, inconsistent curricula and limited postgraduate training in many of the countries prevent practitioners from developing advanced skill in areas like ocular diseases and management. And when I say management, it is diagnostics. And, and many countries, optometrists are allowed to, provide glaucoma treatment and all that medications, but that is probably even not 5% of the total group. The rest are still struggling to get that therapeutic rights. And often it is like scope of practice. There are restrictive policies often prevent optometrists from practicing in their full educational potential, even if a person is masters, and they're doing probably the same work which is a bachelor's is doing. Nothing much to be offered, you know. So I mean, the scope of practice between a diploma from a bachelor's to master's is yet to be defined in a big way. Definitely a WCO competency framework is there, but still a lot of countries are struggling to, implement it. Now let us understand, what is the way forward, how we get into things and how we change the current scenario. So, and I really want this to be a more of engaging session. So anybody has any queries, you can put in the English. I can see, in chat box, it's more in Arabic, so I may not be able to understand. Maybe Dr. Zulfikar, Amir, and Dr. Mustafa, you all can help me understanding, and then probably I would be able to answer it. So the challenges are systemic, but the solutions are within reach. The scope of optometry will be built in only these three connected. So one is you have to integrate the system, which is into the current eye care, and we need to work on primary eye care as a, primary eye care providers. That is what WHO says. The second is getting into technology and use that technology. A lot of things is coming forward. The new technology, AI, is gradually encroaching almost everything. Earlier, we used to have different equipments for different things. Nowadays, most of the things is getting into AI and high-end gadgets, and which can be used in a big way. And definitely, once you are able to deliver all of that, then we can go back to the government and talk about policies to rule and empower the professionals, the optometrists, what they can do, to what extent they can move forward, how they can help the people. Because I personally feel that optometry has huge scope to grow. I think most of us, we are not aware that despite of getting into surgery or anything within optometry, scope is huge. You have to just look, like in management, it is said that you just need to see if the glass is half empty or half full. And I always feel that glass is always empty. You can train your brain, you can learn new things, you can adapt it, you can grow your practice, and that's the way forward. So the technology as a mindset shifter, there are a lot of case studies which is there. And one of such case study is the Arclight device, that a multifunctional solar empowered portable ophthalmoscope and otoscope, seeing the fundus. And imagine, it is so less expensive. Why this came and this attracted, a lot of incorporates, they raise their eyebrows, but it is really inexpensive, to a level of less than $200 to $400. So such low cost thing will definitely help in a big way. And if you are, say, as an optometrist, if you are able to see the fundus properly and understand fundus in a better way, at least you can help and guide patients where to go, what to do. If imagine a patient who is coming to your practice, and he may have underlying cardiac problem. How many of us know that even the cardiac problem can be seen in the fundus? Early thyroid can be seen in the fundus. Hypertensive, aclopathy, hypertension, diabetes is seen in the fundus. Fundus is the only place where you can see the blood vessels. No other way it can be seen. So if you are able to understand, these things in an inexpensive way, technology like this ophthalmoscope with, solar powered, things becomes very easy, and the impact is very high. As a frontline clinicians, you go to community, not many people willing to go in the community and work. Everybody wants a very comfortable kind of, infrastructure where, you're sitting in AC, being in clinic, doing patients. Going to practice, believe me, this is one area which is popping up really big. And this gives you opportunity to serve your own country and your own people who is not able to see just because they cannot afford a pair of glasses, or they are not able to reach, major hospitals to get the checkup done or assessment done, a kind of comprehensive eye exam, right? So a community health worker can perform good eye examination for the first time, going to villages, and that extending the reach of eye care beyond the clinic. It is not a compromise. It is just you have to strategize it and make it as simple to make sure that you serve the people, right? And other part which can be comfortably done is extending expertise with AI and teleoptometry. This is another piece which is popping up in a real big way. As I mentioned, I still recall I had attended WCO 4, which was in Australia. And what I realized was that, there was this, I don't recall the company, maybe Topcon probably. They checked my fundus. They shifted that fundus photo to a different equipment. And with AI, they were able to tell me about my heart health. So imagine what power you have. It is not only about ophthalmology and optometry. You can be into a multi-specialty collaboration with cardiologists, with, uh, endocrinologists, and so on, right? So, this visual clearly explain, as you can see people sitting in village taking picture through mobile and sending it to remote where you collaborate with an ophthalmologist and they can guide what treatment can be done, right? Artificial intelligence. I mean, everything these days, most of the thing, I would say everything, but most of the thing you're getting on phone. And, if you see the current Google AI model, is being scaled in India as well, and Thailand to screen diabetic retinopathy, right? Detecting the disease with retinal images and with very high accuracy. Another case, remote screening, which is a Aldeia Foco project in Brazil using a simple smartphone camera and attachment and AI to allow community workers in the Amazon to conduct screening and connect with patients to specialists remotely. I mean, this is all about collaboration and using the technology where you are. And then, a critical where a promise of AI hinges on quality. 28% of AI models in optometry were trained on fewer than 500 samples, right? So you can see, there are huge opportunity lies within, I would say, developing nations, and a kind of responsibility to serve our own people and, make sure that we provide them the best of the best services which are still available. And in this, to expand this, leadership is needed, and kind of, collaboration is needed. And I've also shared the couple of sources where I've taken these details. Now, integration of primary eye healthcare. I mean, if you really see that, optometrist has a big role to play. We are considered as primary eye care providers. And, again, I see this as huge opportunity. You have to just strategize it. Mobile, when I was talking to one of our WCO colleague, the current public health chairperson, Notembi, and she has a mobile van where she goes to different villages, conduct eye screenings, and then refer it to tertiary centers and treatment plan. So, kind of responsibility she has taken, that rather than sitting into an office or a hospital, she's just reaching out, conducting outreach programs. And that also aligns with, WHO IPCEC model, which is integrated people-centric eye care model. And the purpose and the overall goal and aim is to make eye care a standard part of community health, not a separate. We have to make sure that this is very much accessible and approachable, right? And there are various case studies like, a couple in Thailand, Taiwan, and many more countries. A pair of glasses is costing now less than $1, right? And that is where the photo is. If you see out of every 100 patient coming to an eye clinic, how many people do you think goes for eye surgery? Probably 10-15%. or diseased eye maybe another 10-15%. Friends, 70% of the patient coming to OPD in any eye care practice, ophthalmology or optometry, it is to be served by an optometrist. Whether it is a primary detection of the problem, just giving a simple refraction, or when the treatment is denied at the end, getting into low vision rehabilitation. It's all and all falls under optometry. So probably, we miss the power what we have. We have, in optometry alone, we have more than 20 specialties where people can work on, right? So you have to work as a primary eye care provider as well to do the comprehensive examination. So making the system work, the task shifting from a sustainable model, it is like in India, we have Arvind Eye Hospital in down south, where, the revenue is generated by paying patients cover the operational cost. No other funding is available, and allowing the majority of patients to be provided free on a or heavily subsidized cost. The patients, there are different level of charges, where if the patient is with BPL, which we say below the poverty line, they get free treatment, surgery, glasses, everything for free. Where people who are able to pay, they are paying the full charges. And because of that, every cost is covered. A financially self-sustained model is created, and that has become a global benchmark for quality and accessibility. And there, optometrists are focused more towards, very complex cases and disease management. Again, as I say, disease management, it is with collaboration, right? And this also, if you are completely into a primary eye care, doing comprehensive examination and working along with collaborate with an ophthalmologist, that free up ophthalmologists to focus more on surgery, right? And if you see, at WCO, we have a policy to empower and standardize the profession. The goal is basically to enable optometrists to practice to the full extent of the education and training what they have received. There's a standard global curricula which is on there, and then the expand scope of practice. Level 1, definitely we have to work more on optical technology services, then working on visual function services, ocular diagnostic, and then moving forward to ocular therapeutics. If I share you my practice, and coming from a family business of opticals, which is more than 100 years old, I'm the fourth generation. Gradually, I shifted towards specialty practice. And today, running 4 branches within India, it's pure and pure specialty. We do right from, sclerals to ortho-K, myopia management, dry eye, low vision rehabilitation, vision therapy, neurooptometry, everything, all the specialties we are covering, ocular diagnostics we have. So, and we have collaborated with different ophthalmologists, to work on these lines. So wherever we feel that we need certain, confirmation of disease and with a query, so we ask them to go to a retina consultant or a cornea specialist, get the things done. If medically not done, then definitely we have our own rehabilitation center where we help the patients, And beside WCO, even WHO has, really recognized the role of optometry at this moment. If you see the SPECS 2030 program. So this service, is like S stands for improve access to refractive services. P for personal building capacity to the workforce. E for education, educate the population what is needed and where they should go for. And then C stands for cost, reduce the cost of services, how best we can. And S is for surveillance, strengthen the data and research. And that is where most of us miss, that we don't have data properly, which is organized data where we can, get into research. So the WHO has launched this program to tackle the URE as a leading cause of vision impairment, and probably for the first time, WHO has really recognized the role of optometrist in a big way. The target is basically to achieve 40% of the proportion of the people with access to appropriate spectacles. And our role as an optometrist is basically to strategy outline today directly support how we can do that. And these are the pillars actually to move forward. And we really need to have work very hard on all of this. Now, what is the blueprint? I mean, I'm just sharing you the for sustainable vision. It's like, empowering optometrists definitely. How we will be empowered? It's because with policy, we have to go to the government, collaborate, and drive the adoption and effective use of technology, which is currently available, right? As I mentioned, like teleoptometry and so on. AI, I mean, integrate this AI into your practice. And this will help in a big way. Days are gone then where you had to have kind of, I think the easiest way I've seen people doing it, I don't know in different countries, but in India, I've seen few practices. They take up a picture, they just put it to ChatGPT, a fundus photo, and ChatGPT gives you exactly a kind of tentative diagnosis. Okay, this is what is suspected. And then there's a time you refer to an ophthalmologist saying that, hey, doctor, this is what I'm suspecting. Can you just check it? And believe me, once the ophthalmologist also sees that's an opportunity, that this optometrist actually keep on referring me cases. So they will also similarly feel like sending you cases, like, exchange of patients, right? When you are sitting in institution, it becomes easy. The patient flow is there. You're doing the best of the best work. But as a practitioner, it is slightly harder because, people recognize more of, what we call it so-called like doctors of optometry. And there are very few countries where OD is available. So, and it becomes tough for many people to identify who as an optometrist is. So these are not like separate solutions, but they may be advanced together to build a resilient, equitable, and self-sustaining eye care ecosystem. Integration, eye care at public health centers create the need of policy, expands, the scope and standardization of education. Now, what is the call for action is, for policy makers is legislate for full scope of practice that is still in many countries yet to be defined. Integrate eye care into national health plan, and we have to unite, go with one voice. This is what, and any government only brings in policy when they see that their role is really important to make sure that your contribution in the GDP or the government or health sector or government is huge, immense. So once you start integrating these things with data, supporting with data and research, and then you go to the government that this is what is needed, I'm sure the policymakers are sitting to look at it, and they just cannot ignore the very purpose of what you are doing, right? So so making a mandate service which is really required. For educators, adopt the standardization competency-based curricula like the WCO framework. Embrace innovation training models, including teleeducation and stimulation to scale the workforce. And for professionals and NGO, champion local sustainable solutions and financial model like subsidization, lead the adoption and rigorous validation of new technology to ensure patient safety and trust. So to end my topic, from avoidable blindness to achieve visual equity, the future is not just about preventing loss. It is about creating opportunity, restoring dignity, and ensuring that the ability to see the world clearly is a right for all, not a privilege for some. So thank you so much, Sudani Optometry Society, for giving me this opportunity to be here and sharing some of my thoughts. Thank you so much.
Thank you, Dr. Rajeev, for this insightful keynote lecture. about the direction of optometry in developing countries. You cover most of the things in our mind, but in developing countries we have two types of challenges. Some countries, the accessibility is not difficult, but the problem related to the scope of practice. Okay, this is one of the challenge in developing countries, but there is no problem in accessibility. In some countries, these developing countries include some countries still suffer from the war. There is problem related to the war, other crises. Okay, and you are elected as president of WCO. What's uh, uh, your future direction for you as the chair for this highest organization in the world regarding this different challenges?
Yeah, so thank you, Dr. Zulfikar, for this wonderful question. I think this is what everybody's looking at to hear more. And believe me, I personally feel, and that was my agenda when I was nominated for WCO President-elect. The first thing was I want to work more towards developing nations. That is where the need is. All big things what we talk is there at developed nations. We always look at developed nations. Now, how we can create our own resources, how we can support each other, how we can learn from each other. And I think that is what is needed. And in every country, there's a segment of optometrists who is like very well trained, and there's a segment who's still looking and striving to learn more. I think that is where we have to bridge the gap. As I said, I had a family business of opticals. I was seen more of people who is selling glasses, but I decided to invest my time, energy to do something different. And today I'm running a complete vision rehab center. So I always end up saying that, where nothing is working, I'm there to help you out. Right. So you have one side, you have to collaborate and work. Other side, you have to work on upgrading yourself to a different level. It's been 28 years of my practice. I'm still learning. I'm still a student. And I still say that probably I know 20-25% of optometry. There's a dearth of knowledge which is still laying. We have to make sure that we keep on, learning more things. We can collaborate. I think, Hiba has mentioned about that. Uh, okay, what kind of support you can provide? So, in terms of support, if I say I most welcome, at my personal practice, I mean, since I'm more into specialty, so, I'm offering kind of, fellowship and training programs. If somebody wants to come for a month and observership, we are offering all of that so that you learn, how we are able to cater a segment where the treatment has been denied. I was the first batch of low vision 20 years back in LV Prasad, which is a very well-known institution. And after low vision, I realized that, what is happening is there is huge non-compliance. Patients are not happy with the devices. You take a survey after a year, and patient will say it is very, very cumbersome, to carry that. Then I shifted my practice from selling devices, I would say, dispensing devices, to working on improving quality of life for people with visual impairment. And believe me, that helped a lot. We have to come out of that area where we say that, okay, for distance you are giving telescope, for near you are giving magnifying glass. What else? We are not comfortable with it. What else? So we at times leave these things and we just work on, okay, and these days, patients, I'll say about India and SAARC region at least, you offer some device and patient will Google and Amazon and they'll say, doctor, you are telling me $100 and, it is available at $60. So you feel like, in a way that, you did your best. The patient is not willing to take and they said, okay, just write me a prescription, I'll buy it. So, if you at all move and upgrade yourself, what I see in developing nations mostly is people don't want to invest in the learning. We are going to conferences just because we we want to earn credit points to release, to renew our licenses. How many times we use our timing in their conferences to learn, to upgrade ourselves? That is what is missing. Believe me, every year when I try to go to US to do some certain course, to learn more about things, how to integrate different things. And every time when I go, I always annually I write questions that these are the patients where I'm not able to treat or rehab. What can be done? And when I travel to US, I connect with my mentors, I talk to them. These are the patients I'm not able to serve. Say jerky nystagmus. you give prismatic glasses, patients are not happy. I mean, they're tilting their head, move like, head like this. How we can do that? So now I'm able to fix now at this moment with integration of vision rehab, vision therapy and neuro rehab, how we can reduce the jerk by almost 70-80%. And we have been successful doing it. So once these patient who has been denied for treatment, and once they get better services at your place, believe me, they'll keep you level high. They will never think of whatever hospital you are into. They'll always say optometrists are the best doctors. I've been to these many places, but this is the person who actually helped me. I mean, I see him best qualified than anybody else. And that recognition, what you look at, and that motivates and encourages you to grow. Right? I mean, and public health, one area which people don't look at it. Believe me, public health is growing, and I would say that that is another big area which is people need to think on. How we can serve our own country. Yeah.
Thank you. Thank you. There is some question from Dr. Hiba. She said she thanks you, and she has some questions. She said everyone is aware of the impact of war, current crisis. It is a little bit same as my question in this area. In Sudan, as president of WCO, what kind of support you can provide for Sudanese optometrists and primary care services regarding hospitals, institutions, or anything related to it?
Well,
services can present it for the
I
human.
see at this moment, since I'm president-elect, what I can help is for all the people who cannot travel, definitely we can arrange certain webinars, to make sure that we connect so that sitting at home at your comfort, we can do it. We can plan a small survey that what people are looking at and how I can help, because during the lockdown, I'll tell you the same thing. Exactly what I did was I created a platform called iGurukul, which was an online learning platform. And in 9 months' time, I conducted more than 600 free lectures. I mean, I was never busier than COVID time. Believe me, sitting at home, conducting 2 to 3 lectures every day, because even the faculties were sitting at home. So I requested them, hey, would you mind sparing 1 hour and take a lecture for our own people, on various subjects? And they did it. So, these are the best ways where we can help people like, from war affected area who cannot travel. At least I won't say they'll get all the hands-on experience, but theoretical part definitely can be easily covered and give you more insights about, all the things.
Okay, thank you. Another question from Ayad. She asked, how come we can face the challenge in optometry like myopia control and blindness with low access to resources like modern technology, whether lenses or an instrument, and difficult to collecting data also and training? I think you cover some part of this question. You can,
Yeah, so myopia is a big popping up thing. And I think, we all are optometrists, we do a lot of pediatric refraction. And what we can do is, number one, what is needed in myopia is creating awareness. And believe me, as an optometrist, when you see a patient with -8 or -6, let them know that why myopia is this big, how much, if you don't take care properly, where are we going, whether it is retinal detachment or myopic maculopathy or whatever is popping up. Try to, give them a preventive care also, like, if you go outdoors for 3 to 4 hours, how it is going to help without any, selling product or something. Definitely, if at all they go for, myopic defocus lenses, how it is going to help them. What happens mostly is, when you are into a hospital setup, you have less time to spare. We don't spare much time with the patient. When you are into optical setup, you are seen more as, that you are trying to sell a product. So patient doesn't listen at times. So the best way is, instead of going towards a product, first talk about why this is important. Myopia was earlier also. Why this is important, how this can be prevented, reducing screen time, more outdoor activities and all that. And then give them options that, there's atropine option, there is glasses option, there's orthokeratology option. Based on their financial condition, they need to opt. Number one. Number two, first get them a proper axial length checkup. And instead of jumping onto a product, let us say, okay, like what I do is I ask them, see me after 3 months. Let me see if there are any changes in the axial length. If it is happening, then yes, it is high time to think about the options, treatment options. If it is not moving, I think let us, go very slow. Atropine, believe me, it has to be co-managed. As an optometrist, the very simple answer is we are not allowed to treat a patient. We can rehabilitate them. We cannot treat it. Unless until globally we get this therapeutic rights, and believe me, that will take time. It is not since ages, our seniors has been trying, we are trying. I don't know when we will be able to see, but yes, in developed nations like in US, optometrists are doing LASIK also. So someday we'll be definitely reaching there. But at this moment, it is co-management.
Thank you. There is some question from Dr. Sami. For the people who are raised their hand, please drop your question in the chat box. It is difficult to open mic for the questions because we need to control our time. Thank you, Dr. Rajeev. This is from Dr. Sami. He said, now we are preparing for the scope of practice for optometry in Sudan. And he is now one of the authorities people in the board of specialty of medical health in Sudan. He asked, now they prepare for the scope of practice. He asked if any help can be done for this area from the WCO.
See, as I said, one thing which at WCO we can definitely help is, conducting webinars on the subjects what you're looking at, right? And we can also help you in connecting, say somebody wants to go for training, say in whatever places, probably with our personal connections, we can help you connecting there where you can go for a certain time and get the training done. Right? Or anybody who's looking at some specific support, you can write, back to me, and I'll be more than happy to help you in whatever best possible way.
Thank you. Another question from Dr. Salah. He asked about the future role of optometrists in the field of systematic disease. I mean, to be more especially in one sector of the systematic diseases.
Okay. See, as I said, I mean, personally, it's been 28 years of practice, and I can definitely tell I still see the future is really bright, provided you are ready to accept the change. Days are gone when we used to do plain mirror retinoscopy. We shifted to streak. Similarly, surgeons shifted from ICC surgery to ECC, shifted to phaco, and further on. If you are ready for the change, if you are ready to come out of the comfort zone and learn more, despite of whatever X number of years you are into practice, we are into a disruptive world. AI is taking over. Things are changing every second year, right? So if you are ready to learn more, I don't see any problem. Future is really, really bright. As I said, in India, when I go and deliver talks, I always say that if we have 1.45 billion population, we have 290 billion eyes to see and cater, right? So imagine where we are, the handful number of people, and where people are looking at, us to provide them best eye care.
Thank you, Doctor. There is question from Dr. Hiba. Speak about myopia with atropine. We'll keep it for the next session because we have some full session about this part. We'll present the question for the speaker in this session. There is also a question about thank you for inspiring speech and for reminder us how we are so powerful and how we are help our people in remote area by using technology. If you can tell us more information about I think she mean teleoptometry, yes.
Yeah.
Teleoptometry.
Yeah, so quickly, teleoptometry, I think, as I mentioned, Natumi is doing like eye care camps. You go to camps, take picture, share it with an ophthalmologist, take them guidance, collaborate with somebody, and, you can do a lot of things. Tele-refraction is picking up, So, if at remote place, if you are able to provide these services, I don't see any challenge where, you are not getting recognition, both in terms of professional, personal, financial. Everything is sorted.
I don't know if there is question, you can drop. There is some question from Dr. Bauki. Thanks to Society for this meeting. Hope you more collaboration with ophthalmologists, with us as ophthalmologists. We'll be really sure we'll be to collaborate together because all of us, we are eye care provider for sure. Doctor, if you have comment in this area, collaboration with ophthalmologist and optometrist.
I think this is Dr. Babikir Haja, Babikir Abul Khair, veterinary surgeon in Sudan. So I'm very happy he joined us for this session. Okay.
Welcome, Dr. Babikir.
So let me put it very straight, when you collaborate with an ophthalmologist, okay, when you collaborate with an ophthalmologist and you start giving him cases where your role is not there. If you have started supporting him in whatever possible way, I don't see any reason why he's not coming back to you to support you in the cases what you do and where he doesn't specializes in. It's all about working mutually for the benefit of people of our own countries. And we are all responsible for that. I mean, if we are sitting in whatever positions within the country or outside the country, it is our moral responsibility to go back and work. And the best way, the future of eye care. I mean, I still remember in my hometown where in an ophthalmical conference, I was told that, optometrists are not allowed to ophthalmical conferences. Now, today, we are sitting into an era where in ophthalmic conferences, there has to be an optometry session. If they are respecting us, they are inviting us. Why can't we invite them to our own conferences and share their views? It has to be mutual. It has to be respected mutually. It's just very simple. I mean, it is all about, Newton's third law. The more stronger you throw, the more stronger it will come back. The first thing is you have to take that initiative. You may be trying 3-4 times, maybe, believe me, 5th time, definitely it will come back. Make sure that your effort shouldn't go waste. You keep on doing the things. Today or tomorrow, believe me, God is very kind. They see everything what is moving on. If you are positive, if you are doing great things, it has to be bounced back. I don't see any ophthalmologist who doesn't support optometrists if you are positive and if you are working in a collaboration.
Correct.
Thank you. We have last question. Could you please tell us if there are any future plan to make the job title for optometrists and same worldwide? Because some countries or some optometrists and other another countries is not. He speak about scope of practice. Yeah, if there is possibility to be uniform in between the countries or like that.
Okay. So coming to this, I will say it varies from countries to countries and depending upon the policy makers, how you are interacting with them. If you are able to contribute in that country towards a quality eye eye care. And if it is, one thing is very important, that, if it is seen, it is believed. So let the government see that how optometrists are contributing towards quality eye care. And if it is seen through social media, through collaboration, whatever, I don't see any reason why the country policymakers will not support. But you have to prove it by your work, by your deeds, by your results. It is always said,
Thank-
that grass always looks green, but have you gone there and seen it? Right?
Thank you.
Thank you so much.
Thank you, Dr. Rajeev Parasat, for your insights.